Inside almost any modern otolaryngology clinic, clinical teams spend huge portions of their week buried in mountains of paperwork that have nothing to do with treating sinuses or performing procedures. Data from the American Academy of Otolaryngology Head and Neck Surgery shows the weight of this load. An average ENT office now completes over 40 prior authorization requests every single week. That translates to 13 hours, more than a full workday spent securing insurance approvals. The impact on patients is direct. 93% of physicians surveyed by the AMA report that these administrative hurdles cause significant delays in care. This volume of work triggers a structural squeeze, a systemic collision between dropping insurance revenues and exploding operational costs. Since 2013, general otolaryngology Medicare reimbursement adjusted for inflation has dropped nearly 30%. Over that same decade, wages for administrative support roles surged up to 52%. When the dollars collected per procedure shrink, while the cost of processing those procedures rises, the traditional in-house business model becomes mathematically unsustainable. Solving this through local hiring is increasingly difficult because a base salary is only a fraction of the actual economic burden. When you factor in payroll taxes, benefits, training, and office space, the fully loaded cost for a single in-house administrative employee reaches approximately $60,800 annually. Compounding this cost is a high rate of attrition. Front offices and medical practices currently face an average turnover rate of 20%, meaning you are often paying to replace staff you just finished training. The financial penalty for losing one trained staff member ranges from $17,000 to $26,000, the equivalent of 6 to 9 months of that person's salary spent on recruitment and the productivity gap. In otolaryngology, this is even more disruptive. New hires require weeks of onboarding to understand ENT-specific billing codes and specialty payer requirements before they can function independently. Relying on a local hiring pool for these highly technical workflows creates an expensive cycle of turnover that many practices can no longer afford to maintain. Today, leading clinics are moving away from chaotic internal departments and toward a more streamlined, modern infrastructure. This shift involves a specialized offshore virtual medical assistant model designed specifically to address the hiring squeeze and the technical demands of the specialty. These VMAs act as a direct extension of the practice, working within the EHR systems the clinical team already uses every day. Integration is rapid. These teams connect securely to platforms like Epic, athenahealth, and NextGen, beginning their specific workflows in 48 to 72 hours. This converts a rigid, expensive internal department into an agile extension of the practice that scales as patient volume changes. ENT workflows require a specific level of technical knowledge that sets them apart from basic primary care administration. Dedicated VMAs focus exclusively on these subspecialty requirements. Because they specialize in ENT, they reduce denial rates and speed up the approval process for prior authorizations. To maintain high reliability, the human specialists are supported by an AI-augmented infrastructure. Through intelligent task routing, AI matches administrative tasks to the specialist with the highest historical accuracy for that work. A second layer of anomaly detection flags unusual patterns in billing data before they result in denied claims. This combination of trained specialists and automated quality control keeps error rates below 1%. Moving these workflows to a specialized offshore team does not mean lowering your regulatory requirements. The entire service is built on a compliance framework that includes HIPAA, SOC 2 Type 2, ISO 27001, and HITRUST certifications. The VMA model allows ENT practices to achieve financial stability and ironclad data security simultaneously. When the administrative burden is removed, the clinical team can focus entirely on what they were trained to do: examine patients and perform procedures. As operating costs continue to rise, many ENT practices are finding that outsourcing is becoming a key strategy for protecting their margins. Reducing the volume of paperwork directly addresses physician burnout and allows the practice to return to its core mission. You can test this model in your own clinic to see the impact firsthand. Staffingly offers a 2-week risk-free pilot and a free ENT workflow analysis at staffingly.com/demo. The strategy to resolve the administrative crisis is ready for deployment in your office within 48 hours.